All right, so the best exercise for an SI joint dysfunction. Chiropractors are great at this idea of if something's not moving, getting in there and manipulating your SI joint to get it moving. Some people, however, are hypermobile in their SI joint, and that is something you don't want to be doing a lot of manipulation work with. You're trying to stabilize more of that. And that's why when it comes down to like the best exercise for SI joint, it's not as easy as like the stenosis problem that you can also look at on our videos. So I'm going to show you one that has been used quite a bit for like a self-mobilization of the SI joint. So you might have seen this one online as well, but essentially you lay flat, you grab your knee and you're pulling it over and across. And this you're trying to, in a sense, you're trying to open up that SI joint as you pull your leg across into adduction. You have to be careful because you can see as I do this that my back starts to come off the table, and there's a chance that if the SI pain you're experiencing is coming as a referred symptom, as a sciatic symptom, sometimes you can irritate that. So you have to be careful with this stuff. I mean, some people as they pull over, they'll feel a little pop over here, and that's what they're kind of pushing for as far as the mobilization itself. But as a trial, it's a certain something you can try and get a feel for. So you pull over, might feel a little pull over here. You can hold 1, 2, 3, 4, 5, and then back. And then same thing, 1, 2, 3, 4, 5. And I'd be careful not to be doing this stuff way over this way. So maybe someplace in the middle, and hold 5 seconds, and release. Okay. If that works, if it makes it feel better, then you can certainly continue to do it. Feels like it's irritating your symptoms, and you want to back off. And then you need to seek counsel when it comes to, with a PT to try to discern exactly what's going on with that SI, whether it's moving too much or whether it's moving not enough. All right. Another strategy, that all the stabilization exercises we talked about are good, but for the SI joint, one that I particularly like to add to your list is we start in this position here, and you push down simultaneously with your leg and with your elbow. So you're trying to push into the table as an isometric contraction. The isometric contractions, there's no motion with the contraction. It's just the contraction of the muscles. So 1, 2, 3, 4, 5. Now opposite leg and arm. Push in. 1, 2, 3, 4, 5. Release. And then opposite once again. So what we're trying to do is we're trying to create this sort of cross effect, this diagonal stabilization of the SI joint. Okay, so try those and we'll see where that gets you. Thanks.